For this part of the joints and movement chapter, we're going to be looking specifically at the different types of synovial joints. There are 6 different types of synovial joints as subclassifications, and we're going to look at those using this figure. However, we're not going to follow it exactly in the order given in this figure. Instead, I want to look at it in terms of another aspect of what synovial joints do, which is how many axes of movement we see represented in the joint. An axis of movement would be if we could draw a line through the joint could move around that axis. And we have here 4 different subtypes based on axes of movement. Basically, it represents 0, 1, 2, or 3 axes. And by 0 axes, what I mean is a translational movement is when 2 flat surfaces, two-dimensional planes, move relative to each other. That's not an axis of movement, that's a plane of movement. And then uniaxial joints are those that have a single line drawing through them, and all movements are around that one line, that one axis. Biaxial would be 2 lines drawn through at 90 degrees to each other, and then multiaxial or triaxial would be where a third line is drawn at 90 degrees to the other 2 represented in a biaxial joint, and there'd be movement around all 3 of those. The first synovial joint to consider is the plane joint, and this is a translational movement type of joint. It's when the flat surface of 2 bones move across each other, anywhere in a 2-dimensional plane. The example given here is between tarsal bones, the short bones of the ankle. And what defines a short bone is that it has planar surfaces where it makes joints with other bones. In walking, there are movements going on within all of these joints where one bone will slide across another bone, as a plane slides across another plane. The more common example for this would be in the carpal bones, which are essentially the same type of joint. Carpal bones are in the wrist, tarsal bones are in the ankle. They both move based on the same principles. The first example of a uniaxial joint is a pivot joint, where one bone fits within the joint capsule with another bone and is the axis of rotation. The example we see here is the joint between the first and second cervical vertebra, the axis and atlas bones. Axis is the axis of rotation for atlas, and when you see movement at that joint, that's essentially shaking your head no. There's an extension out of the superficial surface of the body of C2 called the dens of atlas, which is basically the pivot point for atlas to move around for that rotational movement. The second type of uniaxial joint is called a hinge joint, and the perfect example of that is the elbow. Now, a hinge, like on a door, works by having a pin surrounded by 2 metal collars which will rotate both around the pin. In a bone, the pin sort of portion of the hinge is a rounded ending to one of those bones, which in this case would be the distal head of the humerus. And then the proximal head of the ulna is the collar that goes around that pin, and then it can rotate around that. The first example of a biaxial joint is a condoloid joint. Condoloid joints are fairly common throughout the skeleton. The example given here from the book is between the radius and the carpal bones of the wrist. I'd prefer to describe a different joint that's a little more straightforward. In the wrist joint, you have the radius as one side of the joint, but then 2 bones together make up the other side of the joint. And I'd rather stick with just where 2 bones come together to make a joint. And so the example I want to use is the metacarpal phalangeal joint of any of the digits except for the first digit. That's where the proximal phalanx comes to a joint with the metacarpal bone. So if you just think about any of your fingers besides the thumb, making a joint there basically where the palm is, that first knuckle of your finger, it can move in 2 directions. It can move rather significantly going forward and backward, so to speak, and then slightly side to side. One hallmark of a condyloid joint is that one of the directions of movement is greater than the other direction of movement. And so if you think about the wrist, you can move your wrist back and forth pretty easily, forward and backwards, but then side to side is a much more limited movement, and you're going to see that a lot of places where you have condyloid joints. The second example of a biaxial joint is really just a variation on the condyloid joint. It's called the saddle joint, and it moves back and forth and side to side, but in both directions pretty much equally. The thing about the saddle joint is there's only one joint in the skeleton that is a saddle joint, and that's the joint between a carpal bone and the metacarpal bone of the first digit, so at the base of the thumb. And it allows for the thumb to move across the palm so that it can touch the other fingers, making it possible to oppose and grasp around things. It's the basis for what we call our opposable thumb. The final type of synovial joint is the ball and socket joint. It's a multiaxial joint, or triaxial. Multiaxial really just means triaxial, that there's more than two axes of movement, and there can only be three. The ball and socket joint is found really at two major joints, the hip joint, as is indicated by this picture, and at the shoulder joint. The hip joint and the shoulder joint, while they're structurally very similar, have a very large difference between them, which is what makes up the socket part of the joint. The hip has as its socket the acetabulum of the pelvis, which is a bony cup that limits the range of motion that the femur has within that joint. Whereas at the shoulder joint, the socket is largely made up of soft tissue, which we call the rotator cuff, and it allows for more movement at that particular joint, because the soft tissue can give a little bit more and the socket is flexible. The only portion of the socket that's the bony part is called the glenoid cavity of the scapula. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. The saddle joint is the unique type of joint that's only found at the base of the thumb. The carpal bone, called the trapezius, and the metacarpal of the first digit of the hand make that joint. And so that's called the carpo-metacarpal joint of the first digit.